Hey folks, it's Dr. Gerstmar from Aspire Natural Health, and in this quick video, I want to talk to you about bloating. Now, bloating is a super common symptom that people come to see us about, and many of the people that we work with say that they look and feel like they're pregnant, they get so bloated. In order to understand what to do about bloating, we need to understand that there are different kinds of bloating, and there are actually 4 different kinds of bloating we're going to talk about today. You ready? Okay, the first type of bloating is what we call fecal bloating. Now, fecal or feces is the fancy medical word for poop. So it's being bloated because you're full of poop. Fecal bloating is going to be a firm type of bloating, and one of the key characteristics is that it's much better after having used the toilet. So if your bloating builds slowly and each bit of food that you eat feels like it's just adding on top of it, and then things are much better after you use the toilet, there's a good chance you're looking at fecal bloating. Most people with fecal bloating are going to be constipated. Sounds obvious, but sometimes that's not going to be the case. Okay, so we ready for number 2? Number 2, poop joke there. When you're a doctor who deals with poop and bowel movements every day, the fact is you have to take your humor where you can find it. But all right, the second type of bloating is going to be gassy bloating. Now, gassy bloating is where you blow up like a balloon. It tends to come on quickly, typically minutes to an hour or 2 after meals, and can be improved by a bowel movement, but is generally going to be made better by burping or farting out all of that gas. Now, for most people with gassy bloating, if they don't eat, they don't get bloated. The feel of this bloating is more like a balloon, not solid like a fecal bloat is going to be. The third type of bloating is inflammatory bloating. Unlike fecal bloating, which is firm, and gassy bloating, which has kind of a balloon-like feeling to it, inflammatory bloating tends to be squishier. Now, it can come on very quickly after eating a reactive food and doesn't get better for pooping, burping, or farting it out because it's not feces or gas. It tends to fade away over time and is more inconsistent because if you're not eating a reactive food, you don't get the bloating. So people won't say that it's every time that I eat, or the more I eat, the worse it's going to be. All right, the last type of bloating, the 4th type here, is going to be neurogenic bloating. Now, we've got a big word there, neurogenic. Neuro means nerves, or the brain in this case. Genic, like Genesis, means produced by, or birth of, or beginning of. So neurogenic would mean created by the brain. I need to pause here for just a moment because saying something like this can really trigger a lot of negative reactions for some people. When we say created by your mind, that can mean 2 very different things. On the one hand, a lot of people who come to see us have been told by their doctors that what's going on for them is impossible or all in their head, meaning that it's not real and they've made it up. So when we say something is neurogenic, what some people hear is that we're saying that it's not real and they've made it up. And let me be clear, that is not at all what I'm trying to say here. We're using the word neurogenic in the second sense, meaning that what is going on in your brain, in your nervous system, is actually causing real symptoms to happen, to occur. You're not making it up. You're not imagining it. You're not being a hypochondriac or anything else negative. What is occurring in your brain can cause physical changes to happen in your body. So it is in your head, but that doesn't mean that it's fake. It means your brain is awesome, right? Studies of people suffering with IBS or irritable bowel syndrome, where bloating is a major symptom, have shown that a subgroup, a smaller group of people with IBS have this neurogenic bloating. When their intestines were studied for how distended or how bloated they were found to have normal levels of gas pressure and distension. But when these people's brains were scanned, they found that their brains were interpreting these normal signals as problematic. Again, they weren't making it up. Their brains were interpreting the signals as being a problem, even when the signals were considered normal. So it's possible to have all the sensations of bloating, the pressure, the discomfort, the pain, and all the rest, not from what's going on actually in the intestines themselves, but from what's going on in the brain. All right, so there you have it, 4 types of bloating, and yet another reason that there really is no one-size-fits-all way to recover your health. Each type of bloating is going to require a different approach to treatment, and that starts with a proper, thorough evaluation of what's going on for you. Once we know what's going on, we can build the right plan of care to help you. Now, if you didn't know, I've created a number of free reports with some of our best information inside to help with a number of digestive and autoimmune issues. They are all available for free on our website. So if you or anyone you know is dealing with irritable bowel syndrome or IBS, I'd like to offer you the guide that we've put together on how we treat IBS here at Aspire Natural Health. There are 2 easy ways you can get it. And the first is to simply click the button below and fill out the very short form that's there, and we will happily send that to you for free. The second, if you happen to be watching or listening with your cell phone or it's nearby, is to send a text with the word IBS. So send the word IBS to 425-651-6581. That's the word IBS to 425-651-6851, and we will happily send that report to you for free. So please either click down below or text us, and we'll get that expert report over to you right away. At Aspire Natural Health, we are experts at treating digestive issues and autoimmune diseases. If that's you or a loved one, we would love to connect with you. We offer a no obligation, no pressure chat to see if we can help you and if we're the right fit to work together. If we are, we'll move forward, and if we're not, we will do our best to connect you with the person who can best help you. The only thing you have to lose is being unsure what the best next step is for you. So please call us now at 425-202-7849 or email us at info@aspirenaturalhealth.com. All right, folks, until next time, take care.